And thank you for joining us on this Thursday. This is a milestone press conference for us. This is our 60th COVID-19 press conference. The mayor has more on that. The mayor will also share the latest information on COVID-19 and COVID-related deaths. That's Mayor Demings, that is. Information on our testing sites, our eviction diversion programs, small business grants, the micro grants, and more. City of Orlando Mayor Buddy Dyer is here as well. He will be discussing learning. He'll be discussing learning pods, CARES Act funding, and testing in the city of Orlando and other items of interest as well. Last but not least, Dr. Raul Pino from the Florida Department of Health in Orange County has the latest information on statewide testing numbers, our numbers locally here, and other aggregate data on deaths. But we begin this press conference with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you all for being here this afternoon. This is also, we've been on a state of emergency now here within Orange County for approaching, I think, 155 days at this point. And so who would have thought that we would have been on a state of emergency for that length of time? As we are also in hurricane season, we have endeavored to make certain that our residents are prepared, and we have another named storm now at this point, tropical storm Josephine, and this is the earliest point during the hurricane season that they actually got to the letter J. So I don't know what that means for us as we move forward, but I remain confident that irrespective of what happens in the way of weather phenomena or other things, that our very talented staff here in Orange County can deal with whatever comes before us. In terms of the numbers, I'll share the numbers with you today where we are as a county. We now have a total of 32,575 COVID-19 cases within our county. That is an increase of 243 cases since yesterday. We now have 330 deaths as a result of the virus within our community. Dr. Pino is going to talk to you about the most recent deaths that we have. That is an increase of 5 deaths over yesterday, and 32 individuals have died within Orange County since Monday of this week. And so that's really a difficult number to really understand and appreciate, but to all of those families who have lost someone. We always remember their loved ones as well when we talk about it during these press events. Overall, our positivity numbers remain below the state average. Orange County's positivity rate is now 11.7%. That's the cumulative rate, and the state's cumulative rate is 13.5%. Our 2-week positivity rate is trending in the right direction. For the last 14 days, that rate is 10.6%. And yesterday, the numbers that have been reported since yesterday, the positive rate day over day was 6.1%, which is the lowest that it has been for the last 14 days. So as we endeavor to push that number down as low as we possibly can, I think together we're able to do that by working with our health officials and all of our healthcare providers and our entire community. We should be successful in trying to contain the virus here within our community. We have noticed that the demand is going down for testing within our community, but we're continue to work with the state and work with our private providers to ensure that testing is available to those who want to be tested. If you have any symptoms or if you have possibly been exposed to someone with the coronavirus, or if you have traveled and you need to get tested, there are different places that you can go to get tested. We are testing at the Econ Soccer Complex here within Orange County, and I'll come back to that in just a moment. But our research is showing that an extraordinarily high number of infected people have no symptoms. 40%, and some studies indicate that individuals are here amongst us who have no symptoms. Asymptomatic people should be tested as well. That's important. even though some of the sites are focusing on those with symptoms. We have sites around the county. Our Econ Soccer Complex will be open from 8 a.m. to 1 p.m. tomorrow. The team will also be out at the Econ Soccer Complex next week, Tuesday, August the 18th through Friday, August the 21st. You can get information and make appointments by going to our website at ocfl.net/econsoccer. Since Orange County Public Schools started virtually on Monday, our health services has continued to offer testing to minor children from 12 years old and up with the parent or guardian present with the child. Again, you can access that testing at our Econ Soccer Complex next week. Also today, Orange County hosted the state's first mobile testing site at the Holden Heights Community Center. Tomorrow, the mobile site will move to the John Bridges Community Center in Apopka. There's no appointment necessary, and drive up and walk up individuals are welcome. The site will be testing children over 5 years of age. So if you want to get your child tested and they're over 5, you can go to that site in Apopka tomorrow. They are prepared to handle as many as 500 tests each day. Since April the 29th, Orange County Health Services has augmented what the state is doing in the way of testing, and they have tested now over 22,000 individuals within our county. This week, the state's regional testing site at the Orange County Convention Center has now reached the mark of over 101,000 tests that have been given at that one site alone. We ask that everyone in our community who desires to be tested can go to any one of these sites. Again, you can get information by visiting ocfl.net/testing, and you can get information that way. On Tuesday of this week, the Board of County Commissioners unanimously voted to use $20 million of our CARES Act funding to fund the COVID-19 eviction diversion program. The program will launch on Tuesday, August the 25th, and it was designed to help both renters and landlords. So look forward to more information about that for Tuesday, August the 25th. In order to qualify for participation in that program, of course, you got to be an Orange County resident. There must be an agreement between the tenant and the landlord in order to apply for the funds. The renter must be in imminent danger of eviction. They must have one or more members of the household who have a documented loss of income due to the COVID-19 pandemic, and the tenant must be at least 2 months behind on rent. For more information on that, you can go to our website also at ocfl.net/orangecares. And I'm going to transition and talk a little bit about our business assistance program. In particular, we'll start with talking about the micro grant program for home-based businesses. We have received approximately 1,300 applications to date, and the average grant that is being distributed is $2,500. Of course, these micro grant opportunities are made available to businesses, home-based businesses with 3 or fewer employees. I am announcing today, however, it has been a resounding success this week in terms of applications, but this evening we're going to stop taking applications at 6 p.m. Because of the volume of applications that we receive. Again, we will stop at 6 p.m. for the micro grant program for those home-based small businesses with 3 or fewer employees. We'll assess where we are with the available funding, and at some point in the near future, we'll come back and we'll tell you when we will begin taking applications again. However, I will say that for the small business crisis assistance, this is where small businesses of 100 or fewer employees who have a brick and mortar location can apply for grants of $10,000. So far, Orange County has awarded $44.1 million in grant funds and $10,000 increments to the small businesses, 100 or fewer employees located within Orange County who have not received more than $75,000 in Paycheck Protection Program dollars. In addition to that, in terms of our individual and family crisis assistance, we have provided over $21 million at this point to individuals and families. Those checks have been cut directly to individuals through the Orange County Controller's Office. Give you an update on our strike teams in terms of compliance. By the end of today, our strike teams would have visited some nearly 1,000 businesses here within Orange County. The compliance rate has risen to about 82%. We have also started re-inspecting businesses that were out of compliance. All in all, we are seeing positive results from the strike teams that have been moving about our community. I think all of that, as we have desire to increase the wearing of masks and businesses adopting the different sanitary protocols within our community, it is being proven to be successful. The numbers that I just shared with you indicate that. I'm going to turn it over to Mayor Buddy Dyer, and then Dr. Pino will come up and he will reiterate some of the numbers in the positive news, reference the numbers, and he'll tell you the bad news as well. So thank you very much.
Thank you, Mayor Demings. This week's return to school is certainly different for our students than any other year. Some of our young residents will be back in the classroom at some point, face-to-face, and others will continue learning from home. And the start of the academic year is also unique for our students' parents and other family members. So to help accommodate this transition for students and parents, the City of Orlando has launched learning pods. So there are 6 of our neighborhood centers to provide an affordable schooling option for families in our community. The pods provide a out-of-house space for students to complete their studies with access to Wi-Fi and computer labs for students to utilize OCPS's Launch Ed program. City staff will be on site to provide additional academic support. We're pretty much running them like we did our summer camps. There'll be 9 students to 1 counselor, but it provides families with an alternative to either having in-home instruction or at-school instruction, and especially for those parents that maybe can't stay at home with their child and want to. I want to thank the teachers and staff and families for their commitment and despite the challenges to ensuring that our young residents continue to learn. Being out of our normal back-to-school routine is yet another impact of the virus, and as these uncertain times continue, I don't think I would ever come to a press conference where I didn't encourage people to practice mask wearing, social distancing, and good hygiene. But also, we need to be mindful to focus on our own health and well-being. So keeping yourself healthy, both physically and mentally, is important during this time. If you need to talk to somebody or you need some help, reach out today to Heart of Florida United Way's 211 service. They're here to meet your needs and connect you with programs such as emergency food providers, financial resources, and most importantly, maybe, is mental health assistance. Throughout the crisis, we continue not to forget about our community's most vulnerable in need. At this week's City Council meeting, we dedicated federal funding received through the CARES Act to further help those experiencing homelessness and who have been impacted by COVID-19. One item allowed us to contribute CARES Act dollars to the Family Promise of Greater Orlando for rapid rehousing for families out of temporary shelter situations and into permanent residence. We also approved CARES Act funding to further support the Salvation Army's continued expansion of their men's shelter operations to provide 24/7 service with beds that are spaced 6 feet apart for physical distancing. And in closing, I want to reiterate what Mayor Demings did, which remains to the importance of testing. And we've seen a decline in the amount of testing or amount of appointments that are being made as well, but I want to stress the importance so that you know whether you have been infected or not. That's why we continue to expand our testing. We'll be at Camping World Stadium again on Wednesday from 9 to 1. There's no waiting there. I encourage you to make an appointment starting Monday, August 17th at 8 a.m. at orlando.gov/COVID-19. Thank you so much. Dr. Pino.
Good afternoon, everyone. Thank you, Mayor. As Mayor Deming mentions, we have a positive rate cumulative of 11.7%, and also our recovery rate has increased a full percentage point since we talked to you last. It's 92% right now. We unfortunately have 34 deaths reported since we talked to you last. They range from 32 to 96 years old. The 32 years old individual has pre-existing conditions, diabetes, so that was a contributing factor. 7 were female, 27 male, 3 Asian, 5 black, 8 other, 18 white, 8 Hispanic, 16 non-Hispanic, and 10 we don't know their ethnicity. Now, 29 of those individuals had pre-existing conditions. 3 have unknown underlying health conditions, and 2 did not report any conditions. 9 of the 34 deaths happened on long-term care facility residents in our county, and 18 of those deaths occurred before August 10th, before the last time that we talked to you. 6 occurred on August 10th, and 10 occurred on August 11th, or at least were reported on that day. We also have some information on the sites, meaning the long-term care facilities. The highest number of cases is our Orlando Health and Rehabilitation Center, and I would like to remind you that this is a place that has been assigned for isolation and quarantine, so we should expect the cases there to be high. They have 7 additional cases since the 10th. Advante Orlando has only 1 additional case until since the 10th, and that brings their number up to 95. Terra Vista Rehabilitation Center only had 5 additional cases since August 10th. That brings their total to 96. And Ocoee Health Center has cases since August 10th, and that is keeping their numbers at 94. Colonial Lakes Health Center has 79 total number of cases, only 3 additional since the 10th. And I mentioned the additional since the 10th because I want to highlight to you that on August 1st, we have 553 individuals positive in long-term care facilities. And as of today, we have 277. So there has been a significant reduction of the number of people that are in assisted living facility diagnosed with COVID-19, which we will expect will have an impact in the number of deaths. Maybe by next week, earlier next week, midweek, we could start seeing a decline in the death rate. We also have conducted some additional analysis on kids. There has been some interest in that. We are preparing ourselves for kids returning to school, so we are developing our surveillance system approach for this. So in total, since the beginning of the pandemic, 18 and younger, we have 2,221 kids. In the last 14 days, we have 291, with the highest number among kids between 14 and 17. Also, I want to highlight to you that the symptoms in kids more frequent is fever, 39.7% of the kids, but also asymptomatic kids are about 25% of all cases younger than 18. Could you put the next graph? This one is the numbers, the total number that I spoke to you about the cases. Next graph. This is the incidence rate per 100,000 in children. So I was asked yesterday if we have this data, and I want to thank my AP department because they produce it rather quick. Now with the adults, could you put the next one? Oh, we don't have the next one. Yeah, because it was a little bit of a computer glitch. But the adults graph mimics the kids graph to a much degree. So with that is to emphasize to our community that what is happening at home will happen in schools. And the schools are an extension of our community. Therefore, we should take extra measures to protect the kids and to protect other kids in schools. And we encourage parents that if your child is feeling sick in any way, please remain at home. If your child is awaiting a test result, please remain at kids at home until you have the results. If anyone in the family unit is awaiting for a result, the child should not come to school until you have that result, so that we can clearly limit exposure as much as possible for our children, our community, and our teachers. With that, I pass it to the mayor and will answer any questions that you have. And I forgot to mention that we have a first case in a school. It's a private school in Winter Garden. 8 students in the classroom were potentially exposed. The child is 9 years old. They wear masks at all times in the classroom, so we consider that exposure was minimum to the students or the teachers. We determined that this is a community-acquired case. They started on Monday. The child developed symptoms on Tuesday. The class has been placed on quarantine, and we have suggested that the parents of the child and the family unit go out for testing. Thank you.
Lauren Seabrook, I know that you have a question for Dr. Pino, right?
Thank you. Lauren Seabrook, Channel 9. Dr. Pino, we have been kind of looking at the numbers this week. They seem to be a little bit all over the place when you're looking at state numbers. They were really low Monday. Then we had that huge data dump yesterday. They kind of were splitting the difference today. If you could tell us as a community, what is the best set of numbers or set of stats for us to look at to really be able to gauge where we're at with this virus? Because I think a lot of people see these delays and inconsistencies and data dumps and don't really know what to look at right now.
For the number that I look the most at is 14-day positivity rate average rolling. The graph that I always put the wither line, that's the best data for us. Why? Because the accumulative is good in a sense that give you an idea about the whole pandemic, but the majority of those cases are of the infectious period. So if you limit the infection period to the 14 days, and we take out the MLS and the NBA tests that are done at the Disney bubble, then we have a true measure of our community, and that's the 14-day rolling average positivity rate that we provide you with every conference room.
Is there a way for us to get that every day, or for the community to see that every day?
We do not, let me see what's possible. It is not impossible, but our department is quite busy, and they run that every day, that half a press conference to offer it to you, but it's not impossible to run it more often.
Sentinel, this is for Mayor Dyer. Could you tell us a little bit more about the learning pods? How many kids can be there in each of the centers at one time? What kind of precautions are they taking? It sounds interesting.
So we ran limited capacity summer camps this year, and the capacities were determined by the community centers, how many rooms they had, and then how much space was available. We segregated 9 students and 1 counselor, and the same 9 students every time so that they weren't interacting with different people every day. We were highly successful over the summer with that, so we thought we would go ahead and extend it into the school year and give parents an opportunity. Say you have to work, but you don't want to send your child physically back to school. It gives them a place where they can learn and have social interaction with 9 other children. So the 6 centers differ because of size requirements, computer requirements, and Wi-Fi. I think we right now could accommodate at those 6 about 280 students. I don't know how many have taken advantage of it this week. I can report that to you later on. If we reach capacity, then we'll go ahead and open up some additional community centers. We just wanted to judge what the interest was. And we came up with the idea there had been other communities where more affluent families had gotten together to create learning pods themselves with their students, and we wanted to make it available to anybody that, whether they had the means to do that or not.
Hello, this question is for Dr. Pino, Deanna Albritton, Channel 9. So you just talked about how the schools are just an extension of the community. Given our positivity rates right now, are you optimistic? Are you confident about sending 30% of Orange County students back into the classrooms?
So before I answer your question, to rectify my prior statement, it's Winter Park, not Winter Garden. I still have to get straight all the winters and all the lakes. But I will at some point, I promise you. With regard to is it safe, or how alert are we? So the community, the schools are not different than our communities. And what is happening in our community will happen in the schools. Now, the good thing about the schools is that it is a controlled environment where you can set measures in place. We are going to be as good as we are following and adhering to those measures and those steps. The other positive thing is that I understand from the superintendent that 2/3 of the parents have chosen to stay at home, to have the kids at home learning from home. So that will create an environment where you have more ability to space students and to have social distancing. And we encourage everyone to take advantage of the learning, the distance learning opportunity that the system is offering. But it's also the reality that some of the students don't have the best conditions at home to learn. So we have to create that safe environment for them at the schools. We are going to be very vigilant. We are setting systems to alert us immediately when we get these cases in young children. The question is, are we going to get cases? Yes, we are going to get cases amongst children. The question is how quick we respond. And what we don't know is what is going to be the impact of asymptomatic kids in transmitting. And that's very unknown, and it's literature that's coming right now up, and we'll revise. And we are in constant consultation with the Board of Education. We presented last night to the Medical Advisory Board some of our data. So there is an open line of communications, and we are also watching for other districts that started this week so that we can see how things go. So in all sense, we are alert, we are cautiously optimistic, but we are all ready to take action if we need to.
Eric Sandoval with News 6. Dr. Pino, don't leave. This question is for you too, and sort of writing off what you were just asked here. Can you walk through the process of how the Department of Health found out about this student in the private school who tested positive, and the action DOH took, the systems that you guys put in place to address this? Yes,
so our system can alert us of, we can set parameters in the system to alert out of specific cases. So in this case, we will highlight age. So any children younger than this, please pop it up for us. That's what you ask to the system. And then immediately we provide you with that data. So the way this works, early in the morning, we get, in this case, the parents call the schools and the school call us. And that's one way. We are also in constant communication with health services in the schools. And we have that line of communication. And we also have the reporting to the state. So we triangulate this data constantly. So there is one epidemiologist just assigned to the schools. So this person will be canvassing the data constantly, looking for cases younger than 18. And sometimes in the data itself, you cannot establish where the school is. But then that's when our communication with the school system works. We immediately call the health services, and they have the ability to tell us where the child lives, what school does the kids go, are any other kids, siblings, that are in any other schools, so that we can pull those children. So there is a system in place. And also right now, as you saw the data, we are building the analytics that will allow us to monitor this in the future. We also setting up this week a testing site in the Lake Underhill area just for students, for the schools. If we see the need, because we are suspecting that we will immediately quarantine classrooms. So we are not foreseeing us going to the school to do testing at the schools, but we foresee us testing children that has been in quarantine, placed in quarantine by the teachers by us. So we are setting up a testing site at Lake Underhill where we will be able to bring specific classrooms and start testing by appointment, children and contacts, and the families if they need to be tested. So we are developing all those tools, and they should be ready by Monday.
Dr. Pino, one more. I can't promise you one more. I don't know how many more, but real quick. First, are you allowed to tell us which school it was?
Yes, it's called Circle Christian in Winter Park.
Yesterday, I heard you in the medical advisory committee for the school district. You dipped out a little bit early, but the conversation kind of turned to staggering different schools, elementary, middle, and high school. And a lot of the doctors agreed that the younger kids might be a better start. Maybe we should open elementary schools first. In your professional opinion, is that something that you could get behind?
So I was not part of the discussion at that point. I have left the conference because I did my presentation. But we have advised the board prior to this that staggering in and out and cohorting students is the best way to go. So I totally agree with that approach.
Oh, don't go anywhere. Sorry. Eric Mock, Spectrum News 13, going along with the school aspect here. So I was also listening to that meeting last night, and there was a lot of talk about the Orange County mask policy and how parents might, exploit that, and get their doctor to write them a note when their kid can totally wear a mask. Do you have any concerns about, parents exploiting that, and any recommendations about how they should tighten up those restrictions at all?
I don't know. I don't foresee that happening much, but I could be wrong. I think that the parents have the best interest to protect their children, and if they want to do that, they should try training their children how to use masks, not only in the schools, but also in community spaces where masks are necessary. Our students right now are more likely, when they start on Friday, to acquire the disease at community spaces than at the schools. That could change. Is where the virus right now is in our community. And that could change again. But we should continue to protect people in all environments, and we should assume that everyone has the virus. There's a high percentage of asymptomatic people, and the CDC calculates that it can be up to 40% of all infected individuals. So that's a huge number.
This question is perhaps for Mayor Demings. My name is Chris Guardaro. I'm with WESH 2 News. In other areas of the country, when schools have started earlier than this, they've closed some schools when an outbreak did occur. What would that look like in our community? And can you say whether there's like a tipping point on an outbreak in a school that we would need to take action like that?
It certainly is possible, depending upon the actual experience of what happens within the district itself. I am told that tomorrow the school district will have its medical team in discussion, and there will be a special school board meeting on Monday at 4:30 p.m. is what I have been told at this point. And the goal there is to look at the data that they have seen in the country where there have been some schools that have opened prior to our school district, meaning that they had in-person sessions. They're going to use all of that, work with Dr. Pino and the staff, and they're going to make some decisions. So that will be a decision ultimately that our local school district will make. And so I would tell you to stand by for the discussion that they will have this coming Monday. And from there, if they have to, because of an outbreak, close schools or make adjustments, it will be based upon what actually occurs at that time. And so it could look different ways, I think. So I won't speculate on what that will mean for our district. We certainly believe that our district has the best interests of the students and the staff in mind as they will make some decisions. So I believe that likely is what you're going to see happen, given what has been announced at this point by the Orange County Public School system. You're going to see some modifications, I believe, as a result of their discussions on Monday.
This question was texted in for Dr. Pino from Sierra Putman with WFTV. Dr. Pino, during the medical advisory committee, you said that Orange County Health was trying to get rapid tests from a company. I believe it was the National Basketball Association. Is that correct? And how many rapid tests are you trying to secure for schools?
So we have in storage 10,000 test kits of regular nasal swabs in case that we need to use in schools. Those are separate. We haven't touched it. Those are there. With regard to those are not rapid testing. With regard to rapid testing, we are in conversation with a company that sells the product. That's the company that I was referring to. It is a little bit expensive. It's about $41 a test. So we are talking. And with regard to the NBA, we were in conversations with the NBA. They were looking to make some donations to the community, which they have done. I believe they are testing at the Outlets Mall out of, by Route 4, International Outlets, I believe is the name. And we are in conversation with them. We have talked to them about the possibility of having some of those rapid tests also to do any outbreak investigation in the schools, but we don't have a definite answer on that yet.
This next question was also texted in for you, Dr. Pino, from Jesse Canales with News 13. He says, a new CDC report found Hispanic children are 6 times more likely to be diagnosed with COVID-19 and 8 times more likely to be hospitalized than white children. Are we seeing similar numbers here in Orange County? He goes on to say, what is the fatality rate among Hispanic children in Orange County? And with this data, are there any concerns for the health and safety for children returning to in-person learning in lower socioeconomic communities with a high Hispanic population?
So with the easiest first, there has not been any death in children younger than 18 in Orange County. The youngest individual to unfortunately die was 21 years old, and the next younger was 24. The 21-year-old died in a crash accident, a motorcycle accident, but had COVID-19. With regard to the other question, so it's complicated in the sense that this capacity has to be developed in a way that makes sense, and we have the ability to do so. The issue that we are facing with the schools and with the community at large is also there is a lot of emotion and anxiety due to the pandemic. And we want to reiterate that children are affected by the disease, not in the same degree, and it has not been determined why. With regard to Hispanic children, I haven't seen that data. So I don't know, and we haven't conducted any analysis in our data. But part of the issue could be, I suspect that it could be, is also our living arrangements for Latinos. We tend to live in larger family units with in smaller dwellings that are less conducive to social isolation, distancing, and protection. So that could be playing a factor. But we saw in our data when we did analysis by zip code and areas that it was the highest incidence among areas where Latino tend to live in our area, as well as Afro-Americans. So there is no question that there has been a disproportionately affected population, and those are people of color. I don't think that is because COVID-19 in any way affect more a group or other, although we could see that in the data later. But I think that what has happened is that the pandemic has exacerbated and augmented the health disparities that are in our society and that has existed for years.
Can you please respond to that question, the latter part of that question in Spanish as well?
Yes. Sí. I was thinking in English, so it's going to be. Bueno, yo pienso que parte de por qué las personas latinas o de minorías son más afectadas que los grupos de otras razas tiene que ver también con factores socioeconómicos y la manera en que vivimos y dónde vivimos. Nosotros tenemos la tendencia a people of color de vivir en unidades familiares que tienen más miembros, y también podemos vivir en apartamentos y casas más pequeñas, porque es lo que podemos pagar, es lo que podemos tener. Y esos son factores económicos que son importantes cuando tú estás considerando una enfermedad. Entonces el espacio para distanciarse, el espacio para distanciar a alguien que está enfermo y ponerlo en I don't remember the word in Spanish. And, aislamiento. Aislamiento. She doesn't only do science. Entonces hay menos recursos, hay menos condiciones para distanciar y aislar a las personas.
And lastly, this is directed for you, Mayor Dyer or Mayor Demings, from Ryan Lynch with the Orlando Business Journal. Have you or your staff had any discussions with businesses or the Florida DBPR coming to meet with bars and breweries locally this week? And if so, what have those looked like or what's transpired?
So I haven't had any conversations, although I have been made aware that there is going to be a meeting of some sort between and some of our local bars, and that they didn't want elected officials at it.
The short answer is no.
How do you feel about not being invited?
It's okay.
You drinking?
Okay. All right, I think this concludes the press event. Thank you for being here this afternoon. Certainly, if you want one-on-ones, the different speakers are available to do that, and we'll see you soon.